Now it is my honor and pleasure to introduce Melange Matthews. She is the Executive Vice President and Chief Operating Officer for the Public Health Institute. As you all may know, the Center for Immigrant and Refugee Health is one of the programs in the Public Health Institute, and Melange has been there for many years now, over a decade, yes? Yes. Before that, Melange was involved in city government, working with the San Francisco Mayor's Office. And just a couple years ago, she was named as one of the top 100 chief operating officers. So it's my pleasure to introduce Melange Matthews, please.
Salam alaikum, Dobrio Horanko, aloha, good morning. Before, when I knew how to argue with my sisters and brother, without the noise of new words in my mind, before, when my mother stood up for me when the teacher was mad, before, when I knew the rules for playing games, before, when I never got lost or stared at, before, when I knew my way. I penned those words yesterday when I was thinking about the opportunity I've been given to stand with you today for the many voices of immigrant children I have known, and specifically of a domestic violence situation I was counseling many years ago with a very young interpreter. The entire field of trauma-informed communication was not as advanced as it is now. And whatever capacity, whatever focus your work is right now, thank you. If you were involved in the logistics of this conference, Sarah Lackey and team, thank you. If you left a stack of IEPs on your desk and you made it a priority to show up here today, thank you. If you're mired in documenting the outcomes and evaluation for this incredibly important grant award, thank you. If you're sorting out budgets and program impacts and staffing and coordination and outreach through your CBO to new Afghan and Ukrainian students and residents in your community, thank you. Harlan Cleveland once said, "We take 20-year problems with 5-year plans, staffed with 2-year personnels and 1-year budget appropriations, and it's just not good enough." If you represent the federal government through the Office of Refugee and Resettlement, thank you. If you are a state official from the Department of Social Services, and I had a quick opportunity to meet a few of you this morning, and specifically the Office of Immigrant Youth, Carolina Sheffield, thank you. We would not be here together without you. All of us can make a difference every day, but when we have the resources to scale programs, to integrate school and community-based work, there is power and gravity and momentum in that approach. And most importantly, resources give us the opportunity to take positive intention and link it to action for positive impact. People are geometric, and while these awards may impact over 6,000 students and families, we all know that the impact will always be greater than the individual numbers we count and report on. These are particularly challenging times to be a refugee or immigrant in the United States. For those of us in the room who were raised in the States, we were inducted and almost bathed in the ethos of equality, from the declaration that all men are created equal to the golden rule and how we are supposed to treat each other. But we know together as social justice leaders that it is equity that moves us forward collectively. Without addressing inequities of racism, classism, gender oppression, zip code, immigration status, without operating and recognizing from the perspective of equity-based leadership, we minimize the opportunity of making meaningful change. And after all, power is the opportunity to impact change. Years ago, I was a consultant working on a project with the California Endowment and the Annie E. Casey Foundation, facilitating different convenings on how to improve strategies to streamline interpretation in the needs in hospitals and clinics, and later with government agencies and with 911. And one of the challenges for many of the clinics was the amazing work at the time that Kaiser Permanente was doing and investing in phones in emergency rooms and clinics that could be used for access to real-time interpreters who spoke multiple languages. The priority was emerging from the reality that so many kids were being taken out of school in order to accompany a parent or a cousin or a neighbor or an auntie for a medical appointment. And I know that this still happens today. But the real takeaway from those convenings for me was the frustration of so many folks who attended the convening and the conferences because they couldn't, quote, compete with what was being presented as best practice. And after those sessions, I basically banned the term best practice and really worked to share the concept that everyone in this room knows about promising practices. And so whether you're here today from my colleagues I just met from Los Angeles or Elk Grove or Hayward or San Francisco or Sacramento or wherever you're practicing, I encourage you to try and grab a nugget or an element from a program that might resonate with you to make your world one little bit easier or more engaging, and listen for the promising practices. When you bring your superpower of listening and curiosity to the forefront, I know that there will always be a more dynamic and a much more positive exchange. This is the wrap-up of only the first year of this award, and it's the first opportunity for face-to-face sharing and learning. This work is essential. It is the linchpin that integrates social, economic, and mental health stressors with tools and resources for refugee and immigrant students and families. Building bridges between schools and CBOs fosters the kind of coordination and shared goals that helps families integrate and stay together. We know what happens when the moms or the dads or the aunties are removed and the kids are in immersion programs in the schools trying to find their place of belonging. And without the kind of work that each of you brings, that gap widens quickly and painfully. So thank you for the express intention of using these resources to strengthen partnership, integration, and to create the conditions where equity and healing can take root, and where students succeed academically, emotionally, and socially. Conferences are a really special opportunity, especially post-COVID, to leverage this space. So a few reminders. Introduce yourself to the folks you're sitting with at your table. It's okay to celebrate the wins. There is no finish line here, right? So honor the work that your colleagues are doing, recognize the work and the contribution that you have. Be curious, protect your hope. Don't lose faith in your own capacity to be helpful. None of us are perfect, and it's okay to have boundaries in this work. We need them. It's essential, and the work matters, and so do each of you. And I want to echo Dr. Nduni's comments this morning to say thank you for making the time to show up. I've been privileged to work with the Public Health Institute unexpectedly for 15 years. And PHI has been the center of many partnerships with community. By day, as the Chief Operating Officer and EVP, I problem solve just like everyone else in this room, and every once in a while I get to get out of the weeds and stand with you in the presence of true community leadership. And so for just a day, I ask you to forget about the punch list you have at the office and remind yourself that you get to do this work. You've been invited to do this work. You know how to do this work, so share it. Thank you for what you do every day, for your professionalism, and for your deep, deep passion and commitment, for your partnership. And special thanks to a man I hold in deep regard for his vision and commitment, Dr. Mohammed Sadiq Hazratzai, the founder and director of the Center for Immigrant and Refugee Health at PHI. Thank you, Dr. Sadiq. The Nigerian educator Bayo Okomolafe said, "These times are urgent. We must slow down. We must slow ourselves just enough to be strategic with the resources we have, the people, the human resources, and to remember that you are touching sensitive lives." Dozustrici Yakuyu Rushorsk. Thank you so much. I appreciate being with you.